The Primary Reserve Health Benefits Program is a direct result of the 1985 Reserve Pay Study. The program was approved by Treasury Board in June of 1990. The 6 health benefits are: 1. Provincial health insurance rebate; 2. The Group Surgical Medical Insurance Plan, or GSMIP; 3. The CF Dependents Dental Care Plan; number 4, the Service Income Security Insurance Plan, or CISIP, Long-Term Disability Plan; number 5, the General Officers Insurance Plan, or GOIP; and number 6, the Maternity Leave and Allowance Benefits. Unless otherwise specified, this presentation will refer only to members of the Primary Reserve on Class A or Class B service. Members employed on Class C service were previously eligible for all of these benefits, with the exception of maternity leave and allowance benefits. Effective the 1st of October 1990, any eligible reserve member may apply for maternity benefits. The purpose of this video is to outline the procedures required to administer the 4 major plans, and those are the Group Surgical Medical Insurance Plan, the CISIP Long-Term Disability Plan, the Dental Plan, and the Maternity Leave and Allowances. Before we go any further, however, there are a few terms which I'd like to review, which will be used in the administration of these benefits. First, parent unit. This is the unit at which the reservist is actually held on strength, regardless of where he or she is employed. The second term is employing unit, and this is the unit where the member is actually employed. Next, parent accounting unit or office is the unit or office where the member's master pay guide is held, i.e., this is the accounting office which handles the military pay for the member's parent unit. Temporary accounting office or unit is the office that pays the member when he or she is employed away from the parent unit. Calendar year is from 1 January to 31st December annually, and fiscal year is 1 April to 31 March annually. Class B service has been divided into 2 groups for the purpose of these benefits. Class B service of 180 days or less, and Class B service over 180 days. This distinction is important, as is the requirement for accurate record keeping, since a member's eligibility for and his or her entitlement to certain benefits will vary based on the length of that service. A word on common law relationships. The CF now recognizes common law spouses for benefit purposes. Members should consult CAN 4 Gen 002 of 91 for specific details and instructions. An ink stamp has been distributed to all reserve units. This stamp is to be used to administer these benefits and is shown on the slide. We'll start with the dental plan, which is an extension of the existing Canadian Forces Dependents Dental Care Plan. Participation is automatic, provided that the member is not insured through another dental plan. Unlike the regular force, there is no provision for coinsurance. There are no application or registration forms. Full premium costs are paid by the federal government. Coverage under the plan entails a 90% reimbursement of most eligible dental expenses. However, only 50% of major restorative work, crowns for example, and significant prosthodontics, such as complete or partial dentures, are reimbursed. Reimbursement is based on the dental fee guide which was in effect in that province during the previous calendar year. A message from Director General Reserves and Cadets and Director Compensation and Benefits Administration detailing which dental services are covered was sent to all reserve units and support bases in January of 1991. There are some limits to the coverage. For example, the maximum that can be claimed each year is $1,000 for each insured person. Orthodontic care is restricted to dependent children under 21 years of age and has a lifetime maximum reimbursement of $2,000. Therefore, members of the reserve force may not submit claims for orthodontic care for themselves. There is also a minimum deductible amount of $25 per person or $50 per family for each calendar year. Prior to obtaining any care under the plan, however, there is a 3-month waiting period. What this means is that only dental care received after the member has been enrolled for 3 months will be eligible for reimbursement. A reservist on Class A service or on Class B service of 180 days or less will be reimbursed for his or her own dental care only. The dependents of this member are not covered by the plan. Dependents are covered, however, if the member is on Class B service in excess of 180 days. If the initial period of Class B service is in excess of 180 days, then the dependents may receive dental care and submit claims effective the start date of the member's service. Let's look now at how a member goes about claiming for reimbursement. This is broken down into a number of steps. Step 1. Prior to his or her appointment with the dentist, the member must obtain 2 forms from the unit orderly room. These are a primary reserve dental claim form and a copy of the unit certification form. Step 2. Part 1 of the claim form is completed by the member's dentist. This may be done in either of 2 ways. The dentist may fill in the details of the services provided in Part 1 of the form, or the dentist may attach a computerized form to the claim showing the same information. In either case, the dentist's signature and office stamp are required, as well as the patient's full address and signature. Step 3. The member then completes Part 2 of the claim simply by answering each question and then signing in Part 2. Step 4. The member then completes Part 1 of the unit certification form. Step 5. The member then returns both forms to the unit orderly room. Step 6. The unit orderly room will certify the 2 documents by verifying that the dental claim form is properly completed with all required information and all questions answered. Next, they will stamp the claim form with the authorized stamp, and then they will complete Part 2 of the unit certification. This confirms that the member is indeed eligible to be reimbursed. Step 7, the orderly room then distributes the 2 documents. The dental claim form is forwarded to the appropriate regional office of the Great West Life Insurance Company. The addresses are listed on the claim itself. A copy of the dental claim is placed on the member's purse file, and the unit certification form is placed on a subject file which is kept in the unit orderly room. Note that these copies are to be retained on the purse files for audit purposes. If questions arise concerning the member's entitlement to care, or if the dental care required is likely to be extensive, the member is urged to personally contact the nearest Great West Life office. For example, the maximum amount that can be claimed each year is $1,000 for each insured individual. Therefore, if extensive work is required, the member should contact Great West Life to confirm first that the service is covered, and second, the amount that can be claimed. In the case of a member on Class B service of 180 days or less, but who is employed away from his or her parent unit, the member may submit the claim to the employing unit orderly room, or he or she may wait and submit it to the parent unit. It is recommended that for short periods of Class B service, the member submit the claim through the parent unit itself. The dental plan does not apply to members on Class B service in excess of 180 days, since these individuals become eligible for comprehensive dental treatment at CF dental units. Their dependents, however, are entitled to coverage under this plan. Any member on Class B service of more than 180 days may submit a claim for a dependent's dental care immediately, provided that the member has completed the required 3-month waiting period. i.e., the member has been enrolled in the reserve for 3 months. The same steps, 1 through 7, are followed, with the employing unit's orderly room administering the claim. A member on Class B service of more than 180 days who is employed away from his or her primary residence and dependents must mail the dental claim form to his or her dependents. It is then the responsibility of the dependents to ensure that Part 1 of the claim is completed and the form is returned to the member for further processing. Note that Part 1 of the claim is signed by the individual receiving the dental care. Part 2 is completed and signed by the member. Unique dental care certificate numbers will be assigned by each of the command OPIs. These numbers will provide a unique identifier for every eligible member. Dental care numbers have a total of 9 characters consisting of 3 letters and 6 numbers. The letters provide a distinctive designator showing which environment the member belongs to. Blocks of numbers and instructions were issued to commands in January of 1991. Each unit will assign a number only to the members who are eligible to participate. And these numbers will be taken in sequence from the list supplied by the parent headquarters. Eligible members currently serving on Class B service in excess of 180 days should request assignment of a dental care number from their parent unit. These numbers are not related to SIN or service numbers based on Treasury Board directives, and they are assigned on a first-come, first-served basis. Once a member has a number assigned, he or she will retain that number for life. Even if the member transfers from one environment to another, for example, from the Navy to the Air Force, the same number is retained. If a member releases and then re-enrolls, the former number will be reactivated and used again. Any claim submitted without a valid certificate number will be returned to the member. Units must also submit a report twice a year reporting the release of participating members, all new personnel who were previously covered by this dental plan, for example, former regular force members, RCMP, or civil servants, and re-enrolled reserve members who were previously issued a number. This report is to be forwarded to the area or equivalent headquarters by each primary reserve unit. Each headquarters will then combine these returns and forward a comprehensive report to NDHQ, attention DCBA 3, by the 1st of April and the 1st of October annually. Now let's consider the maternity leave and allowance benefit, which applies only to female members on Class B service over 180 days or on Class C service. This benefit provides for 17 weeks of leave for maternity purposes. This may be a combination of annual leave, sick leave, and leave without pay, to a maximum of 17 weeks in addition to a CF allowance. Any Canadian worker with 20 consecutive weeks of employment is eligible to apply for unemployment insurance benefits. A member on Class B or Class C service with 6 months or more of continuous full-time employment may be eligible for a DND maternity allowance, which supplements the unemployment insurance benefits. There is no change in the regulations for members on Class A service or on Class B service of 180 days or less. However, they are eligible for maternity leave in the form of an exemption from drill and training. There is no entitlement for the DND allowance since the requirement to have completed a minimum of 6 months full-time continuous service has not been met. A reservist is eligible for maternity leave if all the following criteria are met. The member has completed at least 6 months of continuous full-time, either Class B or Class C service, immediately prior to the period of maternity leave. The interruption to the member's long-term service is because of her pregnancy and not because her employment contract has been terminated. And finally, the member agrees to serve an additional 6 months continuous full-time service immediately following her maternity leave. This employment is contingent upon CF requirements. There is a waiting period of 2 weeks before unemployment insurance benefits begin. During this period, the member will receive a D&D maternity allowance, which is equal to 93% of her weekly rate of pay, for a maximum of 2 weeks. Unemployment insurance benefits are approximately 60% of one's weekly rate of pay. Once unemployment insurance benefits commence, the member is entitled to a D&D maternity allowance designed to top up her unemployment insurance benefits so that she receives a total of 93% of her weekly pay for a maximum of 15 weeks. As soon as a member suspects she is pregnant, the following steps are to be taken. Step 1. The member will be examined by a medical officer, and a pregnancy report, Annex A to CFAO 56-29, will be started. This report is to be delivered to the unit orderly room. Step 2. The orderly room will ensure that the pregnancy report is completed and will also prepare a message that identifies the pregnant member and gives the following information. A. Her class of service. B. The date the service started and the original termination date. C. The estimated delivery date. D. The geographic location where she intends to reside during the pregnancy leave. E. The proposed dates of leave for maternity purposes. And F. Whether or not the member wishes to apply for maternity allowances. This message must be sent to the member's parent unit, the member's temporary accounting unit, which is the unit administering her pay, the member's parent accounting unit, which is the militia area or land forces area controller, the member's parent command, and Director Military Manpower Distribution at NDHQ. If necessary, authority must be requested to extend the period of service to the end of the leave for maternity purposes period. For Class B service, the Reserve Headquarters must take action. For Class C service, authority must be obtained from DMMD at NDHQ. Step 3. A minimum of 2 full months prior to the beginning of her maternity leave, the member will report to the employing unit's pay office. Here, she will confirm her entitlement to maternity leave and to the allowances, and, for Class C members, stop any existing pay allotments for the period of her maternity leave. At her discretion, the member may continue her coverage of existing benefits, such as long-term disability and group surgical medical insurance plan. During the period of her leave for maternity purposes, however, she must pay the full cost of the premiums for such coverage directly to the insurer. Step 4. The next few steps will vary based on the member's class of service and whether she is remaining in the geographic area or not. For the member on Class B service, a complete out routine is required if she is leaving the geographic area where she has been employed and is returning to her parent unit. In this case, the parent unit will administer the maternity allowance. If she is remaining in the area during her period of leave, and the employing unit will continue to administer her, then only the temporary Class B pay guide needs to be closed off. A full out routine is not required at this time. A new temporary pay guide will be open for the member commencing the first day of the leave for maternity purposes. Note that even if the member remains in the same location, a new pay guide is required during the period of leave because of the change in financial codes. For the member on Class C service, provided that she is remaining in the geographic location and will be administered by the employing unit, no out routine is required, nor is the pay guide closed off. The cost of the maternity allowance is charged against the appropriate financial code once the leave for maternity purposes is completed. If the member is leaving the geographic area, arrangements must be made by the employing unit to have the maternity allowance administered by the nearest Canadian Forces base. The member herself is responsible for completing and submitting her application for unemployment insurance benefits. This is not done through the CF or through the pay office. Throughout her leave, the member must report in to the pay office with the statement of pay received from Unemployment Insurance Commission. This is in order for her D&D allowance to be calculated and paid. Note that any periods of sick leave, annual leave, and so forth are at full pay. The pay office must be notified of any of these periods since this pay is charged against a different financial coding. Furthermore, it is the member's responsibility to notify the Unemployment Insurance Commission of any such changes, since these changes will also affect her entitlement to unemployment insurance benefits. Step 5. At least 2 months prior to the end of her maternity leave, the member shall contact her administrative unit and confirm the date that her leave will end. The unit shall then advise the parent command and DMMD, the Director Military Manpower Distribution, in order to identify a full-time position for the member on completion of her leave, assuming that this has not already been done prior to the actual start of the leave period. If at any time during her leave for maternity purposes, the member's status changes, for example, if she is hospitalized for reasons other than the pregnancy or has a miscarriage and so forth, the administrative unit must be notified immediately. A change in status could affect her entitlement to pay and benefits. A few points on the subsequent period of obligatory service. A member who accepts the Canadian Forces maternity allowance is required to complete 6 months of full-time service immediately following the leave period. This period of service will normally be on the same class of service as the previous service. That is, the member who was employed on Class C will return to a Class C position. The member employed on Class B will return to a Class B position. However, this service is contingent upon Canadian Forces requirements. In the event that a position is not available, the Command and DMMD will request a waiver from Director General Reserves and Cadets, stating that no position is available and requesting permission for the member to parade at her parent unit on a Class A basis in order to make up the obligatory period of service. Let's look now at the Reserve Force LTD, or Long-Term Disability Plan. This plan is offered as one of the services under the Service Income Security Insurance Plan, or SICIP, group of programs. This particular plan provides an opportunity for members of the primary reserve to protect themselves against a potential loss of income because of total disability, which results from a duty-related injury. LTD is designed to supplement any benefits that may be received from other sources if a participant is released from the forces and is totally disabled. This income consists of 75% of a pre-selected monthly amount. The actual monthly amount varies, and I'll explain this shortly. Long-term disability coverage is not automatic. Participation is compulsory for regular force members. However, it is voluntary for a member of the reserves. You must apply for the plan, and your coverage is subject to the approval of the insurer, Maritime Life Assurance Company. There are 2 ways for a member to apply. First, obtain and fill out a business reply card and mailing this card directly to Maritime Life. These cards will be available either from the Reg Force SICIP advisors on bases or from most unit orderly rooms. The other method is to obtain an application form from either the unit orderly room or from the regular force SICIP advisor, filling it out and mailing it directly to Maritime Life. What we'll do right now is review the actual application form and note specific points to be aware of. Although the member is responsible for completing the form, the unit commanding officer or designate is responsible for certifying the form. Therefore, the unit admin staff should be aware of what to look for on the form itself. Basically, this form is self-explanatory. Block 1 is the member's personal information, name, rank, serial number, birth date, etc. Note that the class of service must also be stated. Block 2 is completed only if the member's spouse wishes to apply for life insurance coverage. Block 3 is for the commanding officer's certification. Note that the unit must indicate whether the member is employed on Class A or Class B service. If the member is employed on Class B service over 180 days, a copy of the Class B employment authorization message must be included with the application. The unit must also stamp the completed form with the health benefits stamp, ensuring that the UIC and the date are filled in clearly. This certification should not be done until the entire form has been completed and reviewed. Although no one expects the unit orderly room staff to become instant experts in SISIP or long-term disability, the unit staff must ensure that the member has completed all the appropriate parts of the application and then certify that the member is in fact entitled to make an application under this plan. Block 4 is the medical screening portion of the application form. This is not intended to replace a comprehensive medical, merely to provide a screening. Based on the information that is provided in this section, Maritime Life will determine a member's eligibility for coverage or may determine that a full medical is required. If an actual medical is required, the applicant will be advised of this by Maritime Life. Any such medical will be paid for by the insurer, not the applicant. Members must be aware, however, that a false statement on this part of the form could invalidate any insurance which is offered. Again, the unit staff are reminded that they are not required to be medical experts. However, they must ensure that all questions are answered. Block 5 is the actual request for LTD coverage. Note that the applicant must be a member of the primary reserve. If there is any question of a member's eligibility, the NDHQ SISIP office in Ottawa should be contacted. Do not address questions of a purely military nature to Maritime Life. Note that there are 2 subparagraphs in this block. Only one is to be filled out. Subparagraph A is for members on either Class A or Class B of 180 days or less service. There are 3 levels of coverage for these personnel. The first, or basic level of coverage, is for $2,000 per month. This means that the member who purchases this level of insurance is assumed to have a monthly income of at least $2,000. Therefore, if the member became totally disabled, was released from the forces, and filed a claim, he or she could be entitled to an income of 75% of $2,000, in other words, $1,500 per month. All members will be eligible to apply for this coverage without providing proof of income. For the member whose actual civilian monthly salary is in excess of $2,000 per month, there are 2 additional options for coverage. If the member earns $3,000 per month, he or she may apply for this level of coverage. If the member earns $4,000 per month, he or she may apply for that level of coverage. In order to apply for either of these levels of coverage, however, the member must provide proof of earnings. A T4 slip, etc., is not acceptable as a proof of earnings, since forms such as this indicate previous year's earnings, not current earnings. A letter or a form from the member's civilian employer is required in order to qualify for this coverage. For members who are employed on Class B service in excess of 180 days, the amount of the coverage and the premiums are calculated differently. Unlike the Class A or the Class B of 180 days or less member, whose amount of coverage and therefore premiums are based on a deemed salary, the member employed on Class B over 180 days uses his or her actual military salary as the base for calculations. Therefore, the member fills in the monthly rate of pay, which is the daily rate of pay multiplied by 30, to obtain the monthly salary, and writes this into the space provided. Then multiplies this amount by 4, then divides by 1,000. This gives the amount of the monthly premium. Blocks 6 and 7 are for the reserve term insurance plan. It is not our intent to review this part of the application form, since this particular plan has been in effect for several years. Block 8 is the summary of the premiums required. The premium which was calculated in Block 5 is written into the column on the right-hand side of the form. Then all premiums are added together. For example, if the member is also applying for reserve term insurance or for the spousal reserve term insurance plan. And these premiums are written in on line A in Block 8. This number is then multiplied by the appropriate number of months. For example, the member on Class A or Class B of 180 days or less service would multiply by 12 months. The member who has 8 months remaining in a period of Class B service would multiply the monthly premium by 8. Line 8C then provides the total premium due. Since pay allotments are not available, full premiums are paid annually in advance and must be forwarded with the application form. Block 10 reviews which blocks must be completed for each plan being applied for. It also provides toll-free phone numbers for both the insurer and for the NDHQ CICIP office. Block 11 provides information concerning automatic check service for premium payments. Note the eligibility criteria which are included for this service. Block 12 is for office use only and is not to be used by either the member or the orderly room. Once the member's application has been received and reviewed by the insurer, the member will be contacted directly concerning eligibility for coverage. For example, if the member's application has been accepted, he or she will receive notification of the approval, the effective date, the premium rates, etc. Therefore, approximately 30 days prior to the anniversary of the effective date, the insurer will contact each participant in writing to advise of the upcoming renewal date for the policy. At that time, each participant will be required to advise the insurer in writing that he or she wishes to continue with the coverage and also to confirm that the member is eligible to continue this coverage. The member must respond within 30 days. If, however, Maritime Life does not receive a response within 60 days, then the coverage would lapse. Should the member wish to again be covered under LTD, he or she would have to complete an entirely new application form. In the event that the member's conditions of service change, for example, change from Class A service to a Class B A annotated position, then the insurer must be notified immediately, since this will alter the member's coverage and also the premium. An amended application may be required. However, the member will be notified by the insurer. Again, for a change such as this, a copy of the message authorizing the Class B service must be included with the application or notification of change. The cost of LTD premiums are actually shared between the employer and the employee. Although the member must pay the entire premium initially, the employer, in this case the Canadian Forces, does pay for part of the cost of the plan through a rebate. At the end of each premium period, along with the renewal request, each member will receive a statement of premiums paid, the member's share, and the employer's share. The premium rebate differs slightly based on the class of service. A member on Class B service over 180 days may claim 75% of the actual premium paid. The member on Class A or Class B of 180 days or less is entitled to claim back 75% of the basic or $2,000 per month level coverage premium. The member takes the notification received from the insurer into the unit orderly room and claims the amount using a general allowance claim or a CF52. The CF52 is completed in triplicate in accordance with existing financial procedures in CFAO 209-24. Under authority, however, enter TB Decision Letter 813484, dated 15th of August, 1990. The amount being claimed is written into the right-hand column. A national financial coding has been established to cover the cost of this rebate, It does not come out of unit funds. The unit CO or authorized designate must sign the CF-52, again in accordance with the Financial Administration Act regulations. The original of both claim and notification from the insurer shall be forwarded to the pay office, which would normally process the member's pay. This will be the parent accounting office when the member is employed at the parent unit. But in the case where a member is employed at other than his or her parent unit, then the claim shall be processed by the temporary accounting unit, which handles the member's pay. In this situation, a duplicate claim is to be forwarded to both the parent unit and the parent accounting unit. The next point to look at is what to do when a member becomes totally disabled, and how to determine whether or not a claim should be submitted. First, you need to be aware of what the eligibility criteria are. As noted at the beginning of this section, this plan provides income replacement for members who are totally disabled and who are released from the CF as a result. The minimum time criteria used to determine total disability is 13 weeks. Thus, if someone is totally disabled, unable to work or even carry out their normal activities of daily living without assistance, and is likely to remain so, then he or she would probably be released from the CF. It is at this time that a claim for benefits should be submitted to the insurer. The member or his or her dependents should be advised that this claim must be made within 120 days of release. Once the claim has been submitted, the insurer will investigate the claim to determine whether or not the injury and its circumstances qualify for payment of the benefit. It goes without saying that the requirement for prompt, accurate reports of injury, summary investigations, and so on are crucial to determining whether or not a member is actually entitled to a benefit. The importance of always completing an accident or an injury report cannot be stressed enough. The only way to protect our personnel is to ensure that proper records and reports are kept. The last point we'll discuss is the administrative action required when a member is released from the Canadian Forces. When a member of the CF who is a participant in the Reserve LTD plan is released from the CF, he or she is no longer eligible for LTD coverage. Therefore, Decomp D4 at NDHQ must be advised. The parent unit normally sends a message to the parent command or reserve headquarters, either requesting authority or stating intent to release the member. NDHQ Ottawa, Decomp D4, is to be an addressee on this release message. You must ensure that the release item is clearly stated and that the message states that the member is a plan participant. If the release item is medical or is as a result of a career medical review board, this must be clearly stated in the release message. The location of the member's personnel and medical files must also be specified for Decomp D4's information. For the purposes of this policy, the following definitions of duty coverage have been developed. These are for use exclusively with the long-term disability plan for reserves and are not applicable to any other plans. For reserve force training or duty at a local headquarters, and this includes parades, local demonstrations, or local exercises, on-duty coverage will be effective during these activities and will also be effective during the necessary traveling time to proceed directly to and return directly from the place where the duty is to be performed. The travel time will take place immediately prior to and immediately following the required duty. For reserve force training or duty at other than a designated local area, the member is deemed to be on duty for reserve service while proceeding directly to and directly from the duty location. And for periods of continuous reserve service, on-duty coverage will equate to 24-hour full-time coverage as the member is authorized for such service and is also receiving the entitled pay for the continuous service. The last benefit we'll look at is the Group Surgical Medical Insurance Plan, or GSMIP. All primary reserve members are eligible to participate. The plan covers certain medical and surgical benefits which are not normally covered by provincial health insurance plans. A list of these services is provided in the GSMIP pamphlet, which is available through the CAF, as well as a more general outline of services, which is given in CFAOs. There are actually two plans under GSMIP, the comprehensive and the supplementary plan. The former is available only to full-time service persons who are employed outside of Canada and therefore are not eligible for coverage under a provincial health care plan. Most members of the reserves will not be eligible for this coverage. The supplementary plan, on the other hand, is designed to complement provincial health care coverage. Most members of the primary reserve will be eligible only for supplementary coverage. GSMIP also provides optional hospital expense coverage at one of three levels. Level 1 is automatically included in the premiums. However, levels 2 and 3 are at the member's own expense. The optional hospital expense provides additional insurance for semi-private or private hospital accommodations. For the member on Class A or Class B of 180 days or less, both member and dependents are covered by GSMIP. For members on Class B over 180 days, only the dependents are covered, since the member receives comprehensive medical care through CF Medical Resources. As with the other benefits, participation involves a number of steps. Any member wishing to participate in GSMIP must obtain an application form, complete it, and submit it to their orderly room with premium due within 60 days of becoming eligible for coverage. When the member submits an application, the orderly room should ensure that he or she is aware of the eligible services. The member should be provided with a copy of the GSMIP booklet, which outlines the covered services. The orderly room will check the application form for accuracy and certify it with the health benefits stamp. This verifies that the member is not non-effective strength, or NES. The unit CO or designate must also sign the application. The orderly room submits the application together with the member's personal check or money order for 3 months' worth of premiums. The check or money order is made payable to the Receiver General. The address is DPS, GSMIP Administrator, NDHQ, 101 Colonel By Drive, Ottawa, Ontario, K1A 0K2. Normally, members must apply within 60 days of becoming eligible. However, all members will have 60 days, or 2 calendar months, from the date of issue of the administration instructions in which to submit their applications. Coverage will start on the first day of the month after the premium payment is received. However, those members who elect to apply for coverage after the first 60 days of eligibility will be subject to a 3-month waiting period. About paying the premiums. The premium payments are separated into the employee's share and the government's share. It is important to note that members on Class A service and those on Class B service of 180 days or less pay the total premium. That is, both the employee's share and the government's share. Premiums must be paid for at least 3 months in advance. Whenever a premium payment is submitted, the member will receive a receipt from the GSMIP office. This receipt will show the level of coverage, the total amount paid, and the split between employer and employee shares. The Class A or Class B of 180 days or less member can claim back a percentage of the employer's share of the premium before the 1st of March annually for the previous calendar year. Step 1. The member obtains a copy of the GSMIP rebate form from Annex D to the DCDS instruction and completes Part 1. This form and the GSMIP receipts are submitted to the orderly room. Step 2. The orderly room completes Part 2 of the rebate form and verifies the member's receipts against the unit recap list, which is provided by the GSMIP office. This includes calculating the rebate, which is based on the total number of full days of reserve service over the past year. Step 3. The orderly room will then complete a CF 52. This can be done on an individual basis or as a bulk claim. The authority for the claim is TB Decision Letter 813484, dated the 15th of August, 1990. A national financial code will be used to pay for this rebate, not unit funds. Again, the CF52 is completed in accordance with the existing financial regulations. The completed CF52 is submitted to the parent accounting unit. The claim must include the GSMIP recap list. The receipts which were submitted by the member shall be returned to the member. A copy of the CF52 and the individual's rebate form is retained at the unit on a subject file. What happens when a member accepts Class B service over 180 days? Members employed on Class B service over 180 days in length must submit a change of service notification. The message format is shown in Annex D of the DCDS instruction. This message must be sent to DPS, to the GSMIP administrator, as soon as the member accepts an extended period of service, since this will change the premiums paid. When employed on Class B over 180 days, the member pays only the employee's share of the premium. Therefore, there is no entitlement to a rebate for this period of service. What action must the unit take if a member who is a GSMIP participant becomes non-effective? If a member becomes NES, the unit must notify the DPS GSMIP administrator immediately. This notification is done using the message format provided in Annex D of the DCDS instruction. Claiming for services. The member first pays for services covered by the plan. He or she then obtains a claim form, PSC 1131, from the unit orderly room. This is completed and then submitted directly to the insurer for reimbursement. As indicated in the GSMIP pamphlet, claims for services are subject to a deductible amount. This means that the first time you submit a claim each year, $25 is deducted for an individual or $40 for a family. Then, the remaining amount will be reimbursed at 80% for most eligible expenses. Participating members should check periodically for changes to eligible services and amounts reimbursed. The primary reserve health benefits are the result of several years of work on behalf of all members of our reserve force. These benefits go a long way toward acknowledging the reservist contribution to our country. Any queries regarding these benefits should be addressed to your unit orderly room.